So it's possible to have activities on outdoor swimming pool. And since a week, the indoor swimming pool are also open for activities that lead to NL certification. So, and research, including research. So it's possible to do your research before the opening of the outdoor pool. We are still waiting from the Quebec health agencies for the reopening of waterfront and water park. In the agenda today, we will give you an overview and share with you the principle of lifeguarding and resuscitation during the COVID-19 situation, because we will need to have some adaptation to be sure that it's safe for the bathers and safe for also all the lifeguards. The strategy and guideline presented in this presentation have been made with broad research. But before this presentation, I will give you the chance to Renaud to speak to you about the mission of the society. So Renaud.
Merci, thank you very much again. For us at the Lifesaving Society, our mission has never been closer than the reality we have right now. Promote safe interaction with water to prevent drownings and other trauma is very important. Our Quebec drowning report can demonstrate is very important to open or reopen all the swimming facilities, like what Francois said. Because the patrons, the bathers need a place, the swimmers need a place also. All the athletes need a place for swimming or bathing activities. And to do this at the swimming facility, that's mean public swimming pool, beaches, waterfront, and water park. And particularly with lifeguard on duty, because this is the place where we have the least drowning compared with 40% for drowning in rivers, 30% in lakes, and 15% in the backyard pool. Please stay with us for the next half an hour to follow our webinar. And thank you very much for being with us today, and have a nice conference. And don't hesitate to call the questions and we'll give you the answer at the end. Thank you very much and have a nice webinar.
Thank you, Renaud. The presentation has been based on a broad research that has been made by the National Standard Commission of the Lifesaving Society of Canada and the National Program Commission of the Lifesaving Society of Canada also. We work in concert also with all agencies in the Quebec. We've been working with health agency, with occupational health and safety in workplace. And for us, it's important that all that we present today, it is safe for lifeguard, it is safe also for bathers. So all the protocol have been approved by the public health, Quebec Public Health, all the protocol for intervention and lifeguarding, and also for resuscitation. We work closely with our partner for occupational health, the APSAM. There's a lot of information about occupational health on the website of the APSAM that you could find by our website. In the Quebec website, there's a special section for COVID-19, and I invite you to go there and to consult all the documentation that are in that place that will help you to organize lifeguarding and resuscitation on your swimming pool next summer. So I will leave you with our next presenter. I will leave you with Dave for the agenda of today.
Good morning, all. So as Francois just quickly mentioned, we will be discussing today the modes of transmission for the COVID-19 in our bathing areas. We will address the water quality measures as well as preventive measures to prevent COVID-19 transmission. Then we will address a few elements for lifeguarding and life-saving, and we will follow up with some guidelines for first aid and resuscitation in case of drowning. Lastly, the Licensing Society harassment and misconduct policy will be introduced to you. And as it's been mentioned, feel free to ask questions in the Q&A section, and we will do our best to answer them throughout the presentation or at the end. So what we know regarding transmission of COVID-19 in bathing areas is that COVID is transmitted mostly through droplets. So when people breathe or talk, they are expelling droplets, which can be transmitting COVID-19. Obviously, on a pool deck, we tend to speak a bit louder than we would normally, and this can expel more droplets, increasing slightly the risk of transmission. COVID-19 can also be caught through surfaces. The risks are, however, minor. So we will address how to disinfect the equipment to make sure that nobody gets sick through the equipment. We also know that COVID-19 has a low risk of being caught in the water due partly through dilution of the virus, but also to the fact that it is a very sensitive virus to chlorine. So if we look at the water quality, so the SARS-CoV-2 virus, which caused the COVID-19 illness, is vulnerable in treated pool water. And at the beach, while there's no chlorine, the amount of water is making the dilution so important that the risk of catching the illness is very low. So there's no changes recommended to the water quality standard. It remains for outdoor pools with chlorine between 0.8 and 3 parts per million of free chlorine. The pH levels recommended remain the same. And there's also been no changes in the mandatory closures depending on various incidents that could happen in your facility. The monitoring and the data gathering of all the water quality analysis has also not been changed. We also hear a lot the question regarding making it mandatory to take showers or not when people enter the swimming facility. We would just want to remember that people should always take a shower before swimming, whether it is during the COVID pandemic or before and after. Taking a shower does help to maintain a much better water quality in our facilities, and we recommend that everybody takes it before swimming. Patrons will be asked when they go to the pool to self-diagnosis to know if there are risks of transmission for COVID or not. There are two different categories of symptoms that need to be monitored in that self-diagnosis. So on the left, you can see a list of symptoms that if people have one of them, they should be excluded from swimming and should go back home to self-isolate. So emergence of or exasperation of a cough, fever, so a temperature of 38 degrees Celsius or higher, difficulty breathing, or sudden loss of sense of smell without nasal congestion, with or without loss of taste. So if they have one of those, they should immediately isolate. If they have two symptoms from the list on the right, then the same measure happens. So a general symptom, so muscle pain, headache, severe fatigue, or significant loss of appetite, a sore throat, or diarrhea. We also recommend to maintain social distancing to prevent transmission. So it is recommended that facilities reduce their capacity at the facility to ease the maintenance of the 2-meter physical distance between bathers. It is also recommended to maybe use reservations for people to visit the facility. So for 1 hour or 2 hour blocks or whatever works best in your communities. It's also recommended to have markings on the ground and perhaps create a flow of people in one direction. And it's also recommended to create one-way swimming lanes. So what the Swimming Federation recommends is that the swim lanes be double lanes and people always swim above the black lines at the bottom of the pool. So in lane 1, they go from the shallow end to the deep end, and then they flip to the second lane to come back from the deep end to the shallow end. So that way there's always social distancing when people are swimming. We also recommend to maybe have some family zone in the pool. So it's all about easing the way for people to keep their social distancing while they are swimming. We also, well, public health makes it mandatory for people to isolate for 24 hours if they have any symptoms. We recommend that people wash their hands before entering the facility or as soon as they enter the facility, and then at regular interval. Wearing a facial mask is not recommended in the water due to the risk of choking. So they must, well, they can wear the mask if they want in the building, but then they must take it off before going in the pool. There's too many risks of keeping it. The respiratory etiquettes remain, so coughing in their elbow if they need to cough, staying at a distance, all these things. As usual, it is recommended that people do not swallow water. It is also recommended for facilities to post the hygiene rules around the facility to remember people. And then to have access to the showers and the toilets, but also to make sure that they are disinfected at regular interval as per the recommendation from public health. So this is just a quick reminder about how to disinfect your hands, either using soap and water or with the gel, alcoholic gel. So it's important that you take 20 seconds and that every part of your hand is being cleaned. This will actually prevent you from transmitting the COVID. Physical distancing still applies. We already addressed that. In regarding to equipment and the surfaces, it is recommended that we avoid landing objects such as balls or buckets or any equipment that is not required for safe swimming, because there is risk of contamination that could infect other swimmers. It's also to note that these equipment are often porous and it would be harder to clean them. So depending on your facilities, and this will need to be looked at with your aquatic manager, you could look at letting people bring their own flotation device, such as floaties, dorsal balls to help kids swim, or to bring their own chairs for outdoor facilities. If it's not possible and you have some chairs that you can provide people, just make sure that you have a procedure in place to clean the chairs after people leaving the facility. For safety reasons, it is important that PFDs remain available for swimmers. So we have developed a procedure to clean the PFDs before they get landed to another person. So because the virus is sensitive to chlorine, we can use the pool water to disinfect them. So we recommend that you let them float in the water on one side for 15 minutes, then you flip it over and you can clean it. You can let it there for another 15 minutes, and then the PFD is actually cleaned. We recommend that you let it dry before landing it to another person. If you want to land PFDs on the beach, we recommend that you have a bucket with 3 parts per million of bleach in there, and that you do the exact same thing. Or if you have a mean to actually sink them in the bucket for 15 minutes, if they're sunk, then you can just leave it for 15 minutes before landing it to another person. For the lifeguards, we recommend that the chairs and all the railings to go up and down the ladder be cleaned at regular interval to prevent the spread. And we also recommend that every guard has its own flotation device, whether it's a buoy or a rescue can. That way, there's no sharing of equipment and reduces the risk of transmission. You will note that there's no mention here of the life jacket. The reason why this is that the rescue tube and rescue can actually allow for a social distance that the life jacket does not allow. So at this time of pandemic, we recommend that people use these rescue aid with the rope on instead of the life jacket as much as possible. So we mentioned the virus can survive for a bit of time on surfaces, so it needs to be disinfected regularly. We also recommend that you look at the manufacturer's instructions to make sure that you do not damage the equipment using disinfection product to do your cleaning. And it's also important that you follow the recommendation from the manufacturer for the cleaning product to make sure that your contact time with the disinfectant actually allows for the virus to be deactivated and killed. So if the product recommends for a surface, for a contact time of 15 minutes, and you just quickly sweep it and then, or rinse it off, then the contact time is not long enough and the virus could survive. So it's very important to look at these things. And as you probably expect, the surfaces most frequently touched by bathers are more likely to be contaminated, so we recommend that you clean them a bit more regularly. This being said, the railing to get off the pool with the stairs and these things, we have to keep in mind that people are just exiting the pool with chlorinated water on their hands, so the risk of having those contaminated are a bit lower. This being said, we still recommend that you clean it at regular interval. So I will now pass it to Simon, who will discuss aquatic supervision and first aid guideline with you.
Good morning, everybody. We're going to move on now to supervision, as Dave mentioned. So we'll start by talking about scanning, positioning, rotation. For scanning, right now we're working mainly with outdoor pools as they're the ones that are open. So we just want to remind you, wearing polarized sunglasses is important to minimize the effect of light and being able to see the pool clearly. However, we will be talking about wearing glasses later in the presentation, and those are protective glasses, and your regular sunglasses won't be considered as PPE during first aid. We're really, when we're talking about glasses as PPE, we're really looking for safety glasses like you might have worn in your school labs. So just to make sure we point out that difference. We're going to continue to ask you to position yourself in a way that the entire bottom of the pool is visible to you in a constant manner in your entire zone, but also to make sure that you're 2 meters away from swimmers and other lifeguards. So perhaps there'll be a few cones put around the lifeguard chair to stop people from approaching you. There could be different strategies adopted by your managers. In terms of rotation, you should wash your hands before each rotation. And the lifeguard chair and ladder, as Dave said, should be disinfected between users. And whoever does disinfect it should wash their hands after disinfecting. As you're rotating around the pool too, you should try and keep your 2 meters away from the different swimmers and bathers when moving from position to position. Just a little quick reminder here too, going up and down the chair should be done facing the ladder, facing the piece of equipment. And that's whether you're going up or down, and with 3 points of contact at all times. And we always recommend that you descend the lifeguard chair via the ladder for rescues and avoid jumping directly into the pool. In terms of rescues, we're going to look at 2 main categories. So we'll start with the drowning victim. So here our recommendation for COVID is to use a rescue aid to maintain a distance of 2 meters from the victim. So what that means for those of you who have your National Lifeguard certificate is that we want you to revisit the ladder approach from your bronze courses. So if you can do the rescue maintaining a distance, then it is encouraged to do so. If contact is necessary, then we want you to try and do that in a way that keeps as much distance from your victim's face as possible. So that's approaching from behind. The victim can be encouraged to get out of the water by themselves. And once they're out, you're going to do your follow-up care, trying to keep a distance of 2 meters. So once you're out, you're going to dry off quickly, especially your hands and face. That's going to allow you to put a mask on. And as long as the victim can tolerate it, ideally they'll be wearing a mask too at this point. If you're gonna need to go inside a first aid room, so you're indoors, at that point you're gonna need to have eye protection and gloves, and possibly a procedure gown as well to cover your clothes. For the case of a non-breathing victim, the principles stay the same. It's a rapid ascent while protecting the airway of the victim. You're going to use a towing or carry method to maintain a distance from the victim's airway. So there's different ways to carry that unconscious victim. Choose one that gives you the maximum distance from the victim's airway as you're performing the carry. You're going to exit the water with assistance. So the removal is going to be done with the assistance of another lifeguard from the outside of the pool. And that lifeguard should be wearing their procedure mask and eye protection and gloves. So we're really talking about protective eyewear here and not just sunglasses. Once they're out of the water, the lifeguard who was in the water needs to dry off and put on their procedural mask and their eye protection and gloves. And you would carry out the ABC assessment from a distance. So the biggest thing in breathing checks, as you know, is looking for the chest to rise. So you would only get closer if needed, and we'll talk about the resuscitation procedure shortly if they're not breathing. Okay, so this is for the resuscitation. So for both situations, drowning and for people not in a drowning situation, the PPE is a procedural mask, gloves, and glasses at a minimum, and resuscitation can be done with a pocket mask that has a proper filter. So it's up to your managers and your facilities to make sure they have an appropriate filter that can filter the viral particles at their size. So there is information available to pool managers on what they need to get for your pocket masks. For a drowning situation, we acknowledge, and public health acknowledges, that a drowning situation is normally mainly caused by respiratory arrest when we're talking about resuscitation. So ventilations are important in these situations. Okay, so the ideal situation is you have 2 lifeguards performing the resuscitation procedure. One lifeguard holds the pocket mask with filter tightly during the compressions, and they perform the ventilation. Obviously, this lifeguard cannot be wearing a procedural mask while they're doing it. But because the victim's face is covered with the pocket mask and the other lifeguard has their procedure mask, risks are minimal. They still have to wear their glasses and gloves. The other lifeguard in the duo is performing the chest compressions, and they have all of their PPE. If someone needs to be switched out, it's recommended to switch out the compressor and leave the same person breathing with the mask to avoid having to change valves. If only one lifeguard is available, then we recommend that the elasticated strap on the pocket mask is used to keep a seal of the mask while the person is doing compressions, and that's going to stop any respiratory droplets coming out during the compressions and causing a risk for the rescuer. We'll show you a picture in the next slide, I believe, that will show that. The other possibility is if there are close family members of the victim who feel it can be recruited to help, especially with the breathing, if they have the training to do so. For a case where you're not recuperating a drowning victim, so someone has stopped breathing and they're not in the water. In that case, we're recommending for adult victims that we're going to perform compression-only CPR with the use of an AED. And we recommend that the victim's face be covered with a light sheet, for example, or some other fabric to cover the mouth and nose while the compressions are happening. For children, again, the chances are that we're dealing with a respiratory arrest, and ventilations are still important. So we will do regular CPR with ventilations with the appropriate pocket mask with antiviral filter, and AED is recommended. Remember too that because we're doing these screening tests, the victims are considered low risk for having COVID in the first place, right? So ideally, anyone who's presenting any symptoms would not be allowed in the premises, and the same goes for staff or for patrons. Everyone is completing these self-diagnostics. The picture on the left shows you the pocket mask with the elasticated strap that's holding it in place. So that's a lifeguard position for one rescuer CPR. He can switch easily back between compressions and breaths. And on the right, you have a lifeguard who is at the top of the head, and they're holding the mask, and they're going to be staying there. So there's a compressor just off screen, or just out of the photo that you can't see, and that person's going to maintain the seal during compressions. Both these pictures show with oxygen tubing attached. If you have a mask that has the inlet for oxygen and you're not using oxygen at your facility, it's important that the cover is maintained on the oxygen inlet. So no respiratory droplets of the victim escape through that small hole as well. So this is a flow chart that comes from our national branch that shows this, basically just a summary of what we went over. So you're looking at the risk. And because we're doing screening, it's considered low risk. And you'll see that basically adults are getting compression-only CPR for non-drowning situations. And everyone else for us, an adult drowning or a child in all cases, would get CPR with ventilation and AED. So once this is made available, it's a good chart that could be printed and left in a first aid room or in a staff room. In terms of first aid procedures, these are our recommendations for any first aid interventions. So we want to remind you that lifeguards need to ensure their own safety at all times. It's important that we don't end up with two victims by the lifeguard getting in trouble themselves. You also need to ensure the safety, obviously, of the person you're saving and the other lifeguards and witnesses around. So it's very important to follow all of the safety recommendations. The biggest one, like in all aspects of our current life with COVID-19, is to keep a distance of 2 meters whenever possible, okay? So that means that you can do treatments from a distance. You can encourage someone to put pressure themselves on a bleed. Also, if there's someone from the same family unit where they're able to be within 2 meter distance without any complications, then they can also be used to help with basic first aid. We acknowledge that there are times when an intervention at less than 2 meters is necessary, and then you need to take the appropriate measures, like wearing a procedure mask, protective eyewear, gloves, and a gown. In cases where you are in close proximity and you don't have a surgical gown or a protective gown, it's recommended that you change your clothes and you shower after the intervention.
Yeah, I have a question from the audience. It is regarding the breathing ventilator that are used in emergency situation, or BVM. Why don't we use them for resuscitation on swimming pool?
So the Public Health Institute has recommended a BVM or a pocket mask for use. So both of those would be capable of having the necessary filters. At the moment, BVM isn't a skill that's in the wheelhouse of most lifeguards in Quebec. It's not part of our training. It is something that we're going to likely see in the upcoming years with the new national lifeguard revision. So be prepared for that in the future. But the pocket mask is considered a very acceptable alternative. Both of them are recommended, and it's something that our lifeguards are already very comfortable with using. And I think there's a lot of changes coming out, and if we can keep a measure of comfort by using PPE that we're already experienced with, that it'll help keep things easy for everyone.
Yeah, and I have another question regarding research. How we gonna go? We gonna go research in swimming pool with the COVID-19 situation? Is there a theory that will be replacing practice, or what is going to be like in swimming pool?
So all of the nationals instructors who give you the national lifeguards research have gone through similar webinars to get themselves updated on how they can handle a research in the COVID context. So for example, if you look at physical items, like the time swim or a 50-meter sprint, those are going to be done one per lane to respect physical distancing. We're going to be replacing victims by submersible mannequins in certain cases. And we've really done a good job of looking at all the different skills that we're required to evaluate to check competency levels and adapting them to the situation. So other precautions are using what we call tandems. Those are also referred to commonly as buddy bubbles. So if you have to work in groups of two, you're going to maintain the same buddy, the same tandem throughout the entire research. So that's also minimizing contact. And even in those situations, doing interventions out of the water, you'd be wearing masks to minimize any kind of exposure. So we've gone from cover to cover on the research, looking at all of the potential risks available, the risks that are going to present themselves, and we've taken mitigation measures to minimize those risks to be able to research people, but also to ensure that people are meeting the standards of the award guide to make sure that they have the skills necessary to lifeguard a pool. Going back to the slide, we're at number 4. So the victim is encouraged to wear a mask once they're out of the water, obviously, if they tolerate it. So obviously, if someone's having a big respiratory problem, an asthma attack, hyperventilation, we're not going to throw a mask on them. And after the life-saving intervention is done, then the lifeguards need to dispose of any protective equipment. So some of it is going to be disposable, gloves, the face mask, the gowns, and things like pocket masks that aren't necessarily disposable, and the safety glasses need to be disinfected properly as well. And once all of this is disposed of, make sure that you wash your hands properly before continuing with your regular duties. Here are some examples of posters that you can might be seeing appearing around your pools. So on the left, you have how to take off gloves without contaminating your hands. It's probably something you're already familiar with. It's just important to remind you, even though we have methods to take them out without contaminating your hands, it is still recommended to wash your hands after the gloves are off. In terms of the mask on the right, it's important to remember that you should wash your hands before putting on a procedure mask. That's either with soap and water or with a disinfectant gel. And to remove it, you should wash your hands before handling the mask, so before removing it. And once you've disposed of it properly, wash your hands again before returning to do whatever it is you need to do. So for the mask procedure, you're actually looking at washing or disinfecting your hands 3 times. Once before putting it on, once before taking it off, and then at the end after you've taken it off. The mask needs to be changed if it gets humid, if it gets humid or wet at all, if it becomes dirty, or after an intervention when you've been in close proximity with someone. So some things to remember, some take-home messages here is to wash your hands frequently and to keep a distance of 2 meters, and that's during your lifeguarding preventative duties as well as your life-saving interventions. And this is the same message you've been hearing from governments. It's the same message you're going to hear from us. Washing your hands, 2 meters distance, respiratory etiquette, coughing into your elbow if you need to, or into a tissue that you dispose of right away. Those are going to be our key elements in preventing the spread of COVID-19 in our workplace. Remember to wear the appropriate PPE or protective equipment for procedures where you're going to be within 2 meters of a victim. This equipment should be provided to you by your employer. So it's not a bad idea to check with your pools to make sure that they have this equipment available for you before you start working for them. There's surfaces and objects to disinfect regularly. So high-touch areas around your facility need to be disinfected regularly. Rescue aids, if they have to be passed between lifeguards, need to be disinfected between lifeguards, the lifeguard chair between uses, and equipment that's available to the public, such as lending out life jackets or any other equipment that they might have access to. As you know, the COVID situation is an ongoing situation. It has frequent developments. Things are changing rapidly. So don't expect this to be the end of it. It's important to keep informed, keep an eye on the Life Saving Society website. Information will be posted there as it becomes available. If there's any changes in procedures, you'll be able to see them there. Don't wait for your supervisors, your management to tell you. Be proactive and stay up to date on the information that is developed. So whether it's through the website or if you haven't done so already, I'm sure we encourage you to create an account so you have access to the reserved area, and your dashboard is pretty easy to do on the Society website. And I'll pass it back over to Francois now.
Yeah, thank you, Simons, and thank you, Dave. I want to remember that the Life Saving Society has an harassment and misconduct policy. Our board of directors adopted this policy on harassment and misconduct on April 24, pending the provincial policies for all sports, recreation, and sport federation. The Life Saving Society is committed to put forward any principle of action aimed at establishing a healthy, respectful, and safe environment in order to encourage harmonious relationships between its members. The aim of this policy is to establish appropriate standard and behavior to allow its member to flourish with dignity and respect. The Life Saving Society therefore condemns all form of harassment and misconduct. The policy applies to members, employees, including volunteers of the Life Saving Society, and it aimed to the latter in the course of official activities of the society, like recertification of or lifeguarding course or bronze course. Life Saving Society invite you to consult the said policy in the member dashboard on our website. Anyone with a complaint about harassment or misconduct regarding a member of the Life Saving Society may do so to fill the form that is available, and all the complaint will be treated with complete neutrality. And the aim is to keep safe and a respectful environment for all of our members. I want to remind you that like Simon says, that rapidly changing COVID-19 is evaluating very fast. And I want to remember that the information contained in this presentation do not replace or supersede local or provincial guidance or guidelines from health authority. So you need to follow regional or Quebec Health Authority guidelines in your aquatic facility. So we thank you for being with us. Thank you to Simon, Dave, and Renaud also for this presentation, and to all of you to be here this morning to take time to prepare for the reopening of your aquatic facility. We invite you to consult our special report on our website. And there's also some reference that are available, like the chart that we presented in this webinar, that will be available on this website. And there's a lot of information on occupational health also, and for resuscitation with the COVID-19 area. So thank you, everyone, and